As the country slowly reopens, a growing list of medical doctors are calling for a speedier process. One America's Rion has more on this from Washington.
The shutdown of America has wreaked havoc on nearly every facet of daily life due to the invisible enemy. But Dr. David Samadi, a top urologist and medical surgeon in New York, tells One America News pandemic panic was justified in the beginning, but keeping America shut down is driven by a fear no longer grounded in science. Samadi calls for a swifter reopening.
We all panicked. Even the doctors who've been around, when you get this kind of science presented to you and all these curves, it created a big hysteria. But none of that panned out to be correct. All those models were wrong. It's absolutely time to reopen the country.
Samadi warns even a partial shutdown will render damage to hospitals and the medical community in ways no one seems to be addressing.
The positive margin for these hospitals were always very narrow. Last month, we lost about $50 billion of revenue across the healthcare systems in America. 134,000 healthcare workers lost their jobs, plus the fact that you have 33 million people out there who are out of jobs who don't have healthcare insurance. So what happens? The visits to the ERs are down, cancer screenings are down, and the revenue is not coming in. People are afraid of going to the hospital because of this COVID, and that's going to really do a big damage and possibly bring the hospitals to their knees.
Most of the country is under a sweeping ban on elective surgeries and medical procedures, an order designed to save medical beds for an expected tidal wave of coronavirus patients, a wave that never came.
Open the economy, open the world. This is the time. This doesn't make any sense anymore. And our healthcare system has always been recession-proof, but not pandemic-proof. And I agree with President. He's absolutely right to do this quickly but safely.
Most of the pushback against reopening the country faster is grounded in the fear of a so-called second wave of infections.
We will have coronavirus in the fall. I am convinced of that.
Samadi notes a second wave is inevitable, but the media is ignoring the science and the fact that most hospitals around the country sit empty and are more than capable of handling subsequent waves of this virus.
There's nothing wrong with the second wave. In any kind of infections, you're always going to have the second wave and maybe perhaps a third wave. These curves are just going to be lower and lower and lower. And so if you get a second wave, there's nothing to be afraid of. We're much smarter. We know exactly who this enemy is. This enemy is no longer invisible enemy when it showed up in January or February.
Samadi praises the White House's emphasis on reopening the country and says governors predicating their actions on fear of a second wave or hope for a vaccine are simply ignoring the empty hospital beds across the country, the science, and common medical sense. Rion, One America News, the White House.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.